My talk related to giving a little bit of background, first of all, around the role of NK cells, what NK cells are, what they do in patients with multiple myeloma. And I think it's important to realize that with the onset of myeloma, that there is progressive dysfunction of NK cells. Nevertheless, we are able to harness their function when we use treatments like monoclonal antibodies, when we use immunomodulatory drugs. So they do have a role, the endogenous NK cells in patients. But what I also talked then about was the increasing role for adoptive immunotherapy with NK cells. So instead of using the patient's own NK cells, that we can take either unmodified or genetically modified NK cells. They can be autologous, expanded, ex vivo, or increasingly allogeneic NK cells. And I think that this is an area of increasing interest, and it's following on, hot on the heels of the tremendous advances that we're seeing with the use of CAR T cells in multiple myeloma. And I think, they are somewhat behind CAR T cells, but despite the great initial results we're seeing with CAR T cells, just the scaling this out, I think, to all of the patients who need this type of treatment is going to be challenging with the current model of autologous CAR T cells. So there's definitely going to be an increasing need for allogeneic off-the-shelf therapies, and I think this is where NK cells can play an important role.